Hey friends, it's Masood. Welcome back to Med School Moose. In this video, we are going to be talking all about human metapneumovirus, also known as HMPV. If you're brand new to the channel, welcome. My name is Masood Mohammed. I'm a board-certified emergency medicine physician. I normally create a lot of content for medical students and residents, but I do also create content on other medical topics and things that are in the news today, such as this, so be sure to subscribe to receive all of my latest content. Here's a quick outline of what we're going to be talking about in this video. We are going to answer the question, what is HMPV? We're going to talk about transmission, symptoms, diagnosis, treatment, and finally prevention. Of course, this is not formal medical advice. This is informational only, so let's just jump right into it. So human metapneumovirus, also called HMPV for short, is a respiratory virus that is similar to the common cold, which is also caused by another virus called rhinovirus. It was actually first identified in 2001, so it is not a new virus. This has been around for several decades at this point. HMPV is also in the same group of another virus that some people may have heard of, RSV, that commonly infects children. And it can cause both upper and lower respiratory infections. And I know HMPV is having a moment in the news right now, but this infection is actually very common. There are research estimates out there that show that about 10 to 12% of respiratory illnesses in children are actually due to HMPV. That's about 1 in every 8 to 1 in every 10 children that has a respiratory illness. It's because of this virus right here. And actually, most people get HMPV before the age of 5, so this is not something that is new. There are typically more cases in the winter and in the spring, so some of the cases that we're seeing right now that are getting a lot of attention, this is something that happens normally, so this is not a new occurrence. In terms of the transmission of HMPV, it's all the things that you would expect with a virus. Things like coughing, sneezing, direct contact with someone who's sick, so maybe giving them a hug or shaking their hand, that kind of thing, and then touching surfaces. So the common examples like touching a doorknob. If a person that has this HMPV infection touches a doorknob and they had some virus that sheds off there, and someone else touches the doorknob, that is how this disease can get transmitted. And that's part of what makes HMPV and some of these other viral infections so common, is because they are so easily transmitted by simple things like sneezing or touching surfaces, that kind of thing. So the symptoms of HMPV are similar to symptoms that you would expect with other viral infections, other upper and lower respiratory infections. So things like coughing, congestion, runny nose, fever, wheezing, and shortness of breath. One important thing to note is that these symptoms can be more severe in patients that have asthma, COPD, patients that are elderly, or patients that have medical problems that weaken their immune system. And although these symptoms are milder, they can lead to more serious issues like bronchitis and pneumonia. Another thing to note is that these symptoms are generally more severe with a first-time infection, and if you're infected again in the future, the symptoms are milder because immunity does build up. Your immune system does have some memory when it is infected with HMPV. Now, in terms of the diagnosis of HMPV, this is what a lot of physicians would call a clinical diagnosis. It's really just based off of the symptoms. If you're having coughing, congestion, a runny nose, and you've been around someone that's been sick, more than likely it's a viral infection that's causing this, and there's not any additional workup that needs to be done. Sometimes patients will have a nose or a throat swab done. I'm sure a lot of us are familiar with this now after the COVID-19 pandemic. But this is not done routinely because there are hundreds, if not thousands, of respiratory viruses out there, and we can't possibly test for all of them. So sometimes in some special populations, maybe those that are really, really young and really sick, or those that are really old and really sick, they will do a nose or throat swab, but this is not common practice. Another thing to mention is that your provider may sometimes do a chest x-ray just to make sure that you don't have a pneumonia going on. In terms of the treatment of HMPV, there's no antiviral medication that's going to cure the infection. It really just has to run its course. The symptoms usually last a few days, maybe up to 1 week, maybe a little bit longer in some sicker patients, but it really focuses on treating the symptoms. So simple things like getting bed rest, drinking lots of fluids to prevent dehydration, things like that. In sicker patients, patients that have COPD, who have a low oxygen level, sometimes things like oxygen therapy may be used, and in really severe cases, steroids may be used as well. But again, this is not common practice. This is not something that is prescribed to everyone that has a respiratory viral infection like HMPV. One important thing to note here is that because HMPV, human metapneumovirus, is a virus, it is a viral infection, antibiotics are not effective here because antibiotics are for bacterial infections. In terms of the prevention of HMPV, there's no vaccine because the symptoms are usually mild, but it is simple things that can go a long way in preventing spread of this infection. So things like washing your hands with soap and water for at least 20 seconds. If you don't have soap and water readily available, you can absolutely use an alcohol-based sanitizer. Covering your nose and mouth when coughing, and the important thing to say here is that you don't want to cover your nose and mouth with your hand, especially when you're coughing and sneezing, because that'll increase the chances that you're going to pass this on to someone else. But really coughing into your elbow, sneezing into your elbow, that kind of thing. Of course, avoiding greeting others when you're feeling sick, and considering wearing a mask if you have to go out in public and be around other people. There are some other things like avoiding touching your face, avoiding sharing food, utensils, especially with those that are sick, but these simple steps can really go a long way in preventing not only HMPV, but a lot of these very common respiratory viral infections. Guys, thank you so much for watching. If you feel like you got some value out of this video, please subscribe to my channel to receive all of my latest content, and click here to watch another video that YouTube recommends and thinks you will enjoy. I'll catch you in the next one.